So let's go through and talk about some of the breathing strategies that are in your handout. First, there's diaphragmatic breathing. The purpose of diaphragmatic breathing is to activate the diaphragm. Use the diaphragm as the main muscle of inspiration. The idea is if you use your diaphragm correctly, your accessory muscles can relax, not be stressed as much. You'll take deeper breathing. You actually slow down your breathing. If you do have secretions, it can help mobilize some of those secretions. Typically, you would teach diaphragmatic breathing first in the supine position or the hook lying position, even side lying, and then progress the person to sitting, standing, and then during functional activities. Does it work? There is good research that shows that if an individual has the ability or the lung volume to increase breathing, it works. If they have the room in their abdomen and thorax, the diaphragm to move, it's beneficial. However, think about the person who has severe COPD or very severe COPD. They have a hyperinflated lungs, which push down on the diaphragm, which puts it in a shortening position. So there's not really room for the diaphragm to move. So those people who have severe, very severe COPD, diaphragmatic breathing is not really a beneficial intervention. It's almost like bending your elbow, going into flexion at your elbow, all the way to the end feel, and then asking the person to flex even more. There's really no more room for that elbow to go because of the end feel, because of the end of the joint motion. Same thing for the diaphragm. If it's flattened, there's really no more room for the diaphragm to go. Should you teach it? It's low cost to teach. Those who do not respond well may not be appropriate, but those who do respond well, it can be beneficial. It's something you can take 1, 2 sessions, teach, have the person practice on their own at home in between sessions, see if they catch on. If they catch on, great. If they don't, you can skip it. If someone has very severe or severe COPD, probably not worth your time to teach it though. Also understand that diaphragmatic breathing, we're talking about it for respiratory conditions, but diaphragmatic breathing is beneficial in pain management, back pain, chronic headaches, anxiety, lots of different ways diaphragmatic breathing can be used. So no matter what practice setting you're in, you could be potentially teaching diaphragmatic breathing. Pursed lip breathing, what this is, slows down your breathing. You're breathing in through your nose and then slowly expiring the air through pursed lips as if blowing a kiss or flickering the candles. You don't want to say blowing out the candles because that causes the person to breathe very forcefully, but nice and slow, like you're trying to make that candle flame dance a little bit. This slows down the breathing of the person. It also creates a counter pressure in the airways. So because not all the air is getting out, there's air that goes back in the airways and it helps keep the airways open. So the person who has premature closure of airways because of damage to the airways, especially the smaller airways, this can provide a counter pressure and keep the airways open. Just a couple different pictures of how you might do it or might instruct the person on it. The benefits, it does slow down respiratory rate. It decreases the PaCO2 because you're able to get more air out, more of that CO2 out during expiration. And it does lower dyspnea for some patients. And inspiratory holds, you have the person take a deep breath in, hold it for a couple seconds, and then let it out. You're allowing more time for that diffusion of oxygen and carbon dioxide to happen in the lungs. It can slow a person's breathing down in a good way. It can calm the person down in a good way. So this is a way to get someone to slow down. If their SATs are dropping, their SpO2 drops, you want to try to bring it up. Have them take a nice deep breath in, hold it for a couple seconds, and then let it out slowly. Think about how you can bring together diaphragmatic breathing and inspiratory holds and pursed lip breathing. You can combine those three interventions into one to help improve oxygen delivery and gas exchange. Pace breathing, this is teaching the person in a sense to bring those three things together that I just mentioned. You're working on breathing in, working on breathing out, nice and slow, giving cues either by the physical therapist. This picture here is using a machine. There's a sensor, as you see, around the stomach that is measuring when the ribs are expanding, when they're coming in, and it tries to time it together to help slow the breathing, taking deep breaths, coordinate the breathing. And that brings about good autonomic nervous system modification, slows down the heart rate, calms the person down, benefits from that standpoint. There are a couple breathing techniques I just want to mention. We're not going to necessarily teach you in detail how to do these, but one is the Papworth method. This is the person focused on diaphragmatic breathing, nose breathing, relaxation. It really focuses on being aware of your breathing. This has been shown to be beneficial in those who have asthma. The Buteyko breathing, very similar to the Papworth in the sense that you're focusing on nose breathing, diaphragmatic breathing, helps activate the parasympathetic system. For those who have asthma or breathing problems, it can help them get their breathing under control. If we think about body positioning, this can be beneficial because we can use gravity to impact oxygen transport. As we learned in applied anatomy and physiology, our body is meant to be in an upright position. So get the person in an upright position. It puts the ribs better aligned. It puts the diaphragm better aligned. You take the weight of the heart off the lungs. Upright position is the best place to be, especially when someone's sick and they might be fighting a respiratory infection. Other positions to keep in mind, side lying can be helpful. It can help with lung expansion, secretion, and movement. There's debate back and forth. You put the good side down, the good side up, and based on the condition, that might change a little bit. Prone positioning is a way to improve ventilation and respiration of the lungs, especially when someone has acute respiratory distress syndrome. COVID-19, a lot of patients are being treated with prone positioning to help improve ventilation and respiration. Trendelenburg, that's in a head down position. That can be helpful to drain the lungs. If they have secretions, we'll talk a little bit later. You'll learn later about acid reflux, and it may not always be the best position based on the person. Segmental breathing, this is where you're trying to cue the person. You might be using touch or pressure to get them to expand a certain part of their chest wall. So you might put your hands on their lower ribs and say, breathe into my hands. And you might just put firm pressure on there. You might put a little vibratory stimulation through the ribs, or you might do a quick stretch where the person exhales, you push on the ribs, you kind of rebound those ribs, and you say, take a deep breath. We'll practice this in lab a little bit more to learn these techniques. And I always like to re-show this slide to you. This comes from your physiology lecture. Understand you're not, when you do segmental breathing, you're not changing necessarily the flow of air. That's based on all those pressure differences. So remember, when we think about the lungs at rest, the weight of the lung pushes down the pleura. It causes a lower pressure difference between the pulmonic and the pleural pressure. There's a larger difference up top. So what does that mean? The alveoli in the base of the lungs, the dependent part of the lungs, are less expanded, and that means that air is going to take the path of least resistance, and it's going to go to the bases first and then go there. Okay, so keep that in mind when you're doing quick stretches and segmental breathing. That can be beneficial to get the person to activate the muscles of ventilation. It can be important to use some of the passive recoil of the chest wall to encourage deep breathing, but you're not really changing how the air flows in the lungs. Quick stretch, we just talked about that a little bit, where you put the hands on the rib cage, compress the ribs, and release it right before inhalation. That can help activate muscle spindles, get the rebound of the ribs to bring more air in. And you can do that in numerous different positions. So that brings us to the end of our quick video on breathing strategies.